Hello everyone, today we're going to be talking about the lower eyelids and the fact that so many people come here telling me that, doctor, a lot of my friends and family tell me that I'm looking very tired, that my under eyes are looking very puffy, and this has happened over a period of last 2 to 3 years. Why does this happen? So our under eyes, in the under eyes, we have fat pads. Those fat pads over a period of time, because of aging, there is a septum in front of that. So the septum kind of weakens. So imagine it as a wall. So now the fat pads which are there because of the weakening of the muscle come through, and because of that these fat pads look like bags in front which are under the eye. Hello everyone, today we're going to be talking about the lower eyelids. So what can be done to improve the fat pads? So basically what we do is we go from the inside of the lower eyelid, open it up and remove the fat pads. So there is no other real way of improving your under eyes other than lower eyelid blepharoplasty. You can add a little filler to bridge that gap which is called the arcus marginalis. So you can only camouflage it, but that does not make your eye bags go away. So the only way of improving your under eyes and making it look younger is by removing the fat pads.
What is the minimum age to get a rhinoplasty done?
Depending on facial growth, mental maturity and skeletal growth, I would say the minimum age for women to get a rhinoplasty is 7 to 18 and in men between 19 to 20. Thank you. Here we have a beautiful young patient who has had a congenital deformity called a binder syndrome, where you have a completely flat nose and flat cheeks. So what have we done for you? As you can see here in the first picture, we have given her a nice dorsal profile and increased the height of her nose. As you can see on the sides as well, the profile has come up, and not only that, the cheeks have become fuller by adding fat to them, and the nasal floor has been filled as well. What do you think of the results? Doesn't she look beautiful? How do I prepare for a rhinoplasty? Firstly, you have to have an idea of what you want with your nose, the changes that you want with your nose. You have to come see us. We have to consult. We have to be on the same page. We have to have a plan of action. We can do a 3D consultation with Cosmetic to kind of understand how your nose to a certain extent will look post procedure. Then we have to do a set of blood tests to see how fit you are for the procedure. Then we do the procedure itself. We have to speak about the post-operative road to recovery. Post-surgery is as important as the surgery itself. So, and yes, preparation for any surgery is very important. Let me show you the implants that we use. So these are the kind of implants that we use. So as you see, they're extremely pliable. They are in their 7th generation now. And also, if I can show you on cutting the implant, what happens on cutting the implant. So I'm taking a knife and opening up the implant. Nothing pours out of the implant. So even, some people are skeptical about what happens if an implant ruptures in the body, will the silicone come out? Firstly, the chance of rupture are extremely low, and at the same time there is no chance of the implant coming or of the silicone coming out. A breast reduction is reduction of the size of the breast. Women with bigger size breasts where they have symptoms of neck pain, back pain and infections under their breast are ideal candidates for breast reduction. A breast reduction, like the word suggests, is reducing the size of the breast, which means you are reducing a large chunk of the breast so that the cup size reduces from a certain size to a much smaller size so that they are much more comfortable with their bodies. A breast lift is lifting the breast. In most cases, it is part of a mommy makeover, where after you have given childbirth, after lactation, there is deflation of the breast, because of which it starts sagging. So this is where we lift the breast, and along with that give some amount of augmentation to increase the size of the breast. So think of it as a balloon which has deflated and the nipple goes down, and then now we are lifting it up.
Hello everyone, today I am doing a CO2 laser for our wonderful patient who underwent a body lift. So the patients that I operate, I usually do the CO2 laser myself. So if you can see, how fine the scar is of the body lift. He has maintained it very well with creams and silicone gel sheets. And then now we are doing the next part of his journey, which is the laser.
So Brazilian butt lift is basically where you inject fat into the buttocks from other parts of the body that you have harvested from other parts of the body, that is your abdomen, your legs, and you inject it into the buttocks to improve the contour of the buttocks. What are the risks involved? It is one of those procedures where you have to understand the procedure properly, and the post-op protocol has to be very strict in terms of Brazilian butt lift. The risks involved, they can range from fat necrosis, of where the fat itself dies in the buttocks, and you can have fat necrosis. You can have an embolism. But these kind of risks which are there with the Brazilian butt lift, if done properly and in the right way, the risks are almost nil. So go to a well-trained, board-certified plastic surgeon. Hello everyone. As you can see in these pictures, we are talking about anabolic steroids. The patient here, who has been working out for many years, had taken anabolic steroids for a period of time, because of which they develop man boobs. So you can see, even though his chest is nice and chiseled, the lower part does have breast tissue, and that breast tissue does not go away with working out or by weight loss. So we went in, got the gland out. As you can see here, there are no scars. The gland is completely out, and you can see the masculine shape of the chest is completely retained. This is very common in bodybuilders and in people who are taking anabolic steroids. So take care and make sure you have a supervised medical professional who is helping you with these medications. Well, a hunchback, it primarily depends on what you have. Is it something to do with your posture or the curvature of your spine? If it's that, then you have to see a spine surgeon and then decide if that can be improved. If there is a big hunk of fat in your upper back, then that can be amenable to liposuction. If it's just a lot of skin, then yes, it's difficult to kind of manage that. But if it's fat, yes, it can be reduced and improved.